Yellow.
So she's recovering.
Yes. She's taking the nutritional pack.
Talk to the mother.
In a village in northern Nigeria, a volunteer for the Nigerian Red Cross holds a small multicolored fabric band as she speaks to a gathering of about 30 women, most of whom are holding their infant children.
My name is Jamila Abdulwahab, Mother Club Wamuku. After we gather, we see that there is some of their children are half malnourished. We use that wax tape and we measure them.
Going around the room, she places the band around each infant's arm. The band has 3 colors: green, yellow, and red. If the band becomes tight around the child's arm at the part of the band that's green, then the child is doing okay. If the band tightens around the part that's yellow, the child is probably somewhat malnourished. If it's in the red, then the child is likely suffering from a potentially life-threatening level of malnutrition.
If the baby is malnourished, is in red color, we refer them to the malnutritional center. But if the baby is in yellow, then we help educate them and nutrition on how to breastfeed their baby and breast milk, only breast milk, up to 6 months of age. After 6 months, they will introduce complementary feeding for the baby so that the baby will not enter the malnourished stage.
The problem is that far too many children in this room and around northern Nigeria are coming up in the yellow or in the red. An estimated 2 million children now suffer from severe acute malnutrition in Nigeria, yet only 2 in 10 are receiving treatment. This is due to a number of compounding factors, including conflict, displacement, climate shocks, economic pressures, and weakened health services. But local communities are finding solutions. In this episode of Red Vest Podcast, we take you to several villages in northern Nigeria where local communities are developing durable solutions, and they're doing it through the power of motherhood and fatherhood. Our guides today will be Jamila, a volunteer with the Nigerian Red Cross, who you've already met, and Ikwo Imoke, the health coordinator for the Nigerian Red Cross. Our guest host today will be Aduatomi Bolade, a communications officer for the IFRC, which has been mobilizing resources to address the malnutrition crisis. Now let's start with our first guide, Ikwo Imoke, health coordinator for the Nigerian Red Cross. Ikwo, thanks for joining us today. Can you start by explaining to us what exactly is a Mothers Club?
So the Mothers Club is a group of community women that we bring together, facilitated by the Red Cross volunteer. So we bring together mothers, sisters, aunties, women in the affected communities where we are working, where we give them basic education on how to feed their children with locally available food items that they can source at very little cost. And then we also teach them some basic hygiene habits, basic hand washing, when and how to wash their hands, how to cover and process their food, how to collect water, store it, and dispense without introducing any form of infection or germ into the water that might cause disease eventually.
And why mothers in particular? Why did you start there?
As we know, whenever there's a crisis, we know that the most vulnerable people, the people who are most affected, are primarily women and children. And the mothers stick more to the children in most homes. So the man is busy running everywhere to look for means of livelihood for the families. So we thought it was crucial for the mothers to be educated and be given basic knowledge, adequate enough for them to make informed decisions, for them to understand why feeding the child is as essential as you breathing in and out. So that's what the child needs to stay healthy. That's what the child needs to develop properly. So, so that if the child has access to any form of education, the brain is even well developed enough for that child to do well in school.
Yeah, I can imagine aside from the health consequences, there are many secondary effects of childhood malnutrition. Why is this happening? Why are communities finding it so hard now to feed their children?
Normally, the average farmer will have basic food items in their houses without necessarily going to market to buy. So even if they don't have the money and they have the food, they're able to feed well. But because of the ongoing crisis, a lot of families have been displaced and have lost access to food, access to livelihood. And this is affecting also the health of the people, because someone who is not well nourished is easily prone to a lot of diseases, particularly women and children, especially children under 5. So a lot of children are malnourished because of this situation that has brought about food crisis in Nigeria. People can barely feed now, and that's affecting the health of the people. Immune system is compromised, and people are not very healthy.
So, what are some of the key things that the Mothers Clubs are doing to help start turning this around?
We also encourage them to grow a small-scale local backyard garden in any small space that they have available. We understand that they have lost their farmland and all of that, but we ask that every opportunity that they can find where they are, they should use it to like cultivate a small backyard garden with locally available vegetables that can enhance the nutrition of the family and particularly the children. Most importantly, for this malnutrition appeal, we teach them how to prepare and feed their children with what we call Tom Brown.
So Tom Brown is a local mixture that's made from different grains. One of it is millet, another is groundnut or peanuts, and a few other grains. So this is put together, it's grounded into a powder first, and the value of Tom Brown is that it is a good substitute, it's a good formula for children that are moderately malnourished.
This is Adratomi Boladi, or Tomi as most people call him. He's a communications officer for the IFRC, based in Abuja, the capital of Nigeria. He'll be the second host for this episode. Over the past few years, Tomi has documented the development of the Mothers Club.
We've seen many times where children are moderately malnourished. They're on that borderline between malnourished and severely malnourished, and Tom Brown is applied, and they improve in terms of their weight, in terms of their health. So it's quite nutritious. It's nutrients dense.
Now let's listen to one of Tomi's recordings. Here, Jamila and a Mothers Club member are demonstrating how Tom Brown is made.
We will get our seed, we get our soya beans, our groundnut oil and groundnuts, and our wheat and millet. After that, we wash it, we remove the dirt and spread it in the sun. After that, we use our soya beans.
So it's made the same way you would make, say, oatmeal. You have some hot water, you put the powder in, and you stir until you have like a consistent paste, if you like, and it's served to the child with a spoon and served like a proper meal, and it has done wonders. It's a solution that the Red Cross and Mothers Club are proposing to many mothers in different communities, because it's easy to get, it's not so expensive, and it's also easy to prepare.
You talked about teaching them skills.
Yes, yes.
What skills do you teach them and why?
Okay. The reason why we teach them the skill is we want them to depend on themselves, so that if their husband don't have money to give them to buy soap or something that they need, If we teach them the skills, they will use it and sell it, and they will use the money for their needs. Like this
And this is the
school,
other
we
magic
use this
ingredient that
sesame
goes
seed.
into the mothers'
I teach
clubs.
them how to make the
It's not just
sesame
about
seed.
helping women make some
The
extra
sesame
income.
seed we
It's about a collective
buy it
response
from
that benefits
farmers.
the larger group.
First, we
Equo,
use
can
it
you
for
comment on how that works?
and you
Some
bring
of them also use these monies that they have gathered among themselves to now prepare it and sell to other women who may not be part of the mothers club or who do not know how to prepare it. So it's also a form of income generation for them to support the nutrition of their family. Also, we teach them basic skills like making liquid soap for house use and maybe for hand washing also. And if they have the means, they can even make it on a commercial basis and sell. Some people want to learn how to bake, so we also teach them that. And then the women also come together by themselves to form small, locally we call it osusu. What it means is if we are 20 women that are in a particular club and we're not well to do, so every week when we come together to meet, we come maybe like 100 naira, depending on what they agree. Some 200, some 500. So they rotate that money among themselves. So all the 500 will be given to a particular woman in a particular week. So the next week, another person gets all the 500. Another week, another person gets all the 500. So it's like a local cooperative that they have formed among themselves to support themselves. As we know, even their husbands are struggling with providing for the families. So we just are also teaching them how to come up with small means to be able to support the family.
But it's not always as easy as breathing in and out, to paraphrase what Equo said earlier. A recent story from Tomi illustrates the challenges that mothers can face when making decisions for themselves or for their family's health.
I think we were in Zamfara not too long ago, sometime this year. Zamfara is in the northwest of Nigeria, and we wanted to record some lady who had given us the opportunity to record the making of Tom Brown. Anyway, we wanted to record this lady making Tom Brown, teaching us how to make Tom Brown in Zamfara, in this community in Zamfara. And she had agreed for us to go into her house to do the recording. But out of nowhere, some guy just screamed at us and told us that we couldn't go in, that the man of the house wasn't around. And because the man of the house wasn't around, we were not allowed to go into the house. The man of the house would have taken offense, that's her husband that is, would have taken offense if we had gone into the house without his consent. So you still have cases like that where you need the consent of the head of the house, the husband, before you access their house. If you are a male, that is. I don't know the origin of it, but for many of these communities, this is still in place. And if you look at that just as a metaphor, you see that the power still rests with the men of the family or the husband over the wife. And I can just imagine several other things that the wife needs to run through her husband before it is done, before she can embark on it, and so on and so forth.
We learned from our previous experience that some women were not able to join the Mothers Club because they did not have the permission of their husbands or spouses. So what we did in that, using that opportunity, we now started the Papa's Club, where the men were now involved in the same activities that the women were involved in. So they come together once a week to discuss issues around nutrition with our volunteers. So the men now are more involved in the nutrition of the family. Now they understand more why their wives should be given the permission to attend the mothers club. Now they understand why the feeding of the child and the family should be prioritized over some other things that they might want to do. And this is really, really helping, because now we don't struggle so much or talk so much for the community members to respond to what we are doing, because now they're having understanding of why we are bringing these women together and what the women are learning by coming together to meet with the Red Cross. And not just the fathers, because the Papa's Club also includes brothers, uncles, and older fathers. Everybody has to be involved. The father, the mother, and if there are grown-up children, everyone has to be involved. It has to be everyone's business. So now he is more involved, and he understands when the wife says, I'll need money to buy this or to buy that or to do this. If he has it, he no longer hesitates to provide that money, because he now understands that a child who is not well nourished is not a healthy child, and that child will be low in energy, might easily fall sick, and can even develop complications that might lead to death.
Have there ever been times in which that dynamic has led to a real problem or a blockage in terms of a child getting care?
Yes, we have, and it was quite heartbreaking to me. Recently, we went to one of the states in the north where the volunteers are referring the severely malnourished children that they found in the houses, because they're conducting house-to-house screening for malnutrition of children. So they found this particular child. So when the child got to the OTP, on further assessment by the health worker, they discovered that this child, beyond being severely malnourished, already is developing some complications. The child had edema and other complications. So the health facility further referred this child to a stabilization center where the child was supposed to be admitted and treated properly. But this mother, when she got home and told her husband the situation of things, her husband said that she cannot take the child to the hospital to be admitted. The head of health facility called the man and talked with the guy on phone. The guy will not agree. So she now got a team of people. They even went as far as escalated to the local government authority, health authority, which they did. And the local government health authority also tried to send a team of people to intervene and talk to this man to see how he can allow this child to be admitted, but he still will not agree. The family of the wife intervened, he will not agree. His own family intervened, he will not agree. So it was such a heartbreaking news and situation for us.
And do you know what then happened with that child?
So the child is stuck with the ready-to-use therapeutic food. And for the week where we saw that child, they said the child had improved a bit, but because the woman did not come out for 2 weeks, so it means the child was not fed. So the child had gone back from between red and yellow to now being in red completely.
Unfortunately, the woman can't just take the child to a health facility without the sign-off of her husband, and the child is suffering. It was really sad to see, but we have those situations where the control, the power is with the husband or the man, and except he yields, nothing is going to happen.
Do you have any idea why that man had the objection?
I do not know, to be honest. It could be a number of factors. I do not know, but I definitely know that it's not religion, it's not government policy, And from the way I read that community is also not social, it's probably just personal. So I don't understand the context of the family structure, so I really can't make any conjecture, but it's something that was very strange to me and other colleagues who were there. But unfortunately, there's nothing we could have done about it, and there's really nothing that the woman also could do. And from the way she spoke, she's more or less helpless. So we still have those situations where the woman and maybe the children are not as free to express or exercise some liberties because their father, their husband doesn't sign off on it, which is for me is one of the strong reasons why Papa's Club should be encouraged and should be a group that we gravitate towards. Because if more men understand that, their wives, their children need to have access to healthcare facility, need to eat this type of food, need to wash their hands regularly, need to go to school, and so on and so forth. Whatever the message is, if more men have that understanding, it creates easier access or easier acceptance for everybody in society.
In that same village, meanwhile, another father is walking through the narrow alleyways near his home, picking up litter, chatting with friends and neighbors. His name is Poave, and once he's home, he starts cleaning up his yard, sweeping up leaves, and stacking wood to make a small cooking fire so his wife can make the evening meal.
Papa's Club has created a lot of awareness to us concerning how we should live with our people and also our children, how to clean our environment and also give us a clean environment for our children to live healthy. Because Papa Club has been trying. Without Papa Club, we know that some of these things that happened before, we took our wives like slaves before, and without minding how they feel. We don't have them doing some things. And later on, we realized that Papa Club said, no, it is not our only duty to do that. All this tradition and other things has made us to believe that women are less than men. So when Papa Club come, they give us gender equality and make sure that we treat them equally and give them sense of belonging.
So can you tell me some of the activities that you do in Papa's Club?
Yeah, we always create time to show ourselves how to wash hands before doing anything, more especially sweeping, cleaning, maybe sanitizing everywhere to make sure that the environment is clean. Papa's Club are taking a lot of time to teach us how to go with the modern generation concerning washing hands before you start eating or doing anything concerning even your healthy. You must wash your hands first before you start anything, and you will clean your environment that you are in to make sure that that place is clean for the health of your children and the family entirely.
And are other men as receptive to Papa's Club as you are? Are people reacting the same way as you are to Papa's Club?
Yes, because I want to say I am not only a member, but I'm also one of the elders in the community. I serve as a community head secretary. So it is also my duty to go around to see whether people are doing what Papa's Club are doing and make sure that they stay safe. And due to my observation, I'm going around and I know that people change for good.
Are women happier? Are women happier now than before because of Papa's Club? What has been the reaction of your wife? Let's start with your wife to some of the behavior change that you have had.
Sometimes before my Papa's Club came, let me say, my wife do a lot of house choice alone. Although she doesn't complain because we believe in tradition, we believe that it is their responsibility to do so. But later on, when Papa's Club came and create awareness, I can be able to assist her cleaning. Sometimes if she's cooking, I will be holding children and make sure that I pamper them so that they will not cry much. And sometimes I even ask her to stay aside. I will cook. So my wife is happy more than before now. Even if I come back, even me, if I come back, how the smile in my wife's face, I see that it is different.
And is there a lot of social pressure for men to be a certain way? Like if they start appearing like they're too sensitive to their wives, to their family, that they're seen somehow outside of the home as being a little bit weak or not as, not the strong man that they sometimes are told they have to be in society?
I don't know. I don't know if the pressure is as overt, but I do know that there is a desire for men to be strong and not show emotions and not do what would be considered effeminate or domestic. There is that, but whether people get censured for doing that is another kettle of fish entirely, and I don't think it's widespread. I don't think it's widespread in Nigeria. There are quite a number of men who are actually very supportive of their families. They are open about their affection for their wives, for their children, and how supportive they are of their family. So it's not something that would get you censured or cancelled in Nigeria. But yes, there are quite a number of people who still hold on to the traditional way that a man is supposed to be, quite a number of them. And yes, it's changing, but it's not something that generally would get you cancelled in Nigeria, if I might put it that way.
So, homie, I want to ask you a personal question. Are you ready?
Shoot.
So how about you? Do you have a family? Are you married yourself?
Yes, I am. I'm married.
You are?
I have 3 kids, a set of triplets.
Triplets?
All girls.
So you know what question I'm going to ask you next. In visiting with the mothers' clubs, and in particular the papas' clubs, did that help you or make you think about yourself in any way? Did you come away from that with any new insights just about your own life as a man, as a father, as a husband?
I think generally as a father, as a husband, as a Nigerian, that some of us are fortunate. No matter how bad we think things are with us, we are actually very fortunate with where we are compared to what people are going through, what people have to deal with on a daily basis. That these people carry themselves with so much dignity is something that many of us can also learn from.
When you come from outside, you think these people, they are so helpless. They are depending on, they need external help and all of that. I have learned that community members have learned how to sort themselves out. And what that has taught me is, don't take for granted the opportunity or privilege that you have. That it could have been me in this situation that I'm looking at.
Thank you so much for joining us today, Ikwo, for the Red Vest Podcast.
Thank you, sir.
Thanks for listening to the Red Vest Podcast, a production of the International Federation of Red Cross and Red Crescent Societies. In every episode, we feature inspiring, thought-provoking stories and analysis from around the IFRC's humanitarian world. Let us know what you think. Send us a message to redvest@ifrc.org. And please click the subscribe button on your streaming platform to make sure you hear every episode of Red Vest.